February is American Heart Month. It's dedicated to spreading awareness about the leading cause of death for men and women in the United States, heart disease. It comes in many forms, including atrial fibrillation, also known as AFib. Dr. Mo Jallo of the American Pharmacists Association from Washington, D.C. Good morning, doctor. How are you this morning?
Good. How are you?
Fantastic. So what is AFib, and I guess what are the potential complications?
Yeah, so AFib is where you have like a regular heartbeat. Now the problem is this heartbeat can cause you to have blood clots as well as having a heart failure or make it hard for your heart to work. And then the worst thing is it can cause a stroke, and this can lead to long-term disability.
Yeah, you don't want AFib. So what are the most effective ways to reduce the risk of some of these AFib complications?
The best thing is taking blood thinners. So the way they work is they decrease the amount of clots that can form in your body. However, they come with the risk of increasing bleeding. However, what's kind of accepted in the medical community is in most cases, the benefit of protecting you from having a stroke usually outweighs the risk of bleeding.
Yeah, I know some people that have AFib. I've got a couple family members, and I know that they take medication that's prescribed, but sometimes they don't always take the medication as they should. What type of impact can that have on somebody with AFib?
Unfortunately, that can make it easier for you to end up in the hospital, and that could cost you, as well as your family, as well as the overall healthcare system, so much money going into the hospital. I think there was a study that found that over $100 billion, and I said billion with the B,
yeah,
is spent because people are going to the hospital because they're not able to take their medications.
Yeah, well, I got a kind of, it's more of a general question, but what role do you think pharmacists can play in helping people understand their medicines and making sure that they really take them as they're supposed to, as they're prescribed?
Yeah, so I think pharmacists, we're like the medication experts of the healthcare team. And I think what we can do is make it easier for people to understand how medications should work, why they work, as well as what are the benefits, as well as what are the side effects. And we could even provide tips to make it easier for you to take the medication, as well as reduce the risk of a side effect.
Yeah, doctor, I know you spent some time in Omaha. You spent a couple of years here. You're out of Washington, D.C. right now, but you spent some time at Creighton, right?
Yep, I spent 2 years there. I did a 2-year fellowship in their drug information center, and everyone at Creighton University were so welcoming, and it was one of the best learning experiences I ever had.
Well, I'm sure some of those people at Creighton are watching you right now. Went on to continue to pursue your career, but I'm sure you had a good time in Omaha. Where can we go for more information about some of the topics we discussed this morning?
Yeah, people can go to the American Heart Association website. I think actually they do a good job of providing information about what is heart disease, what is atrial fibrillation, what are things that can reduce your risk, as well as what are resources you can use to be educated about it.
Awesome. Dr. Jallo, thanks for your time this morning. It was good talking to you.
Good talking to you too. Tell everyone I said hi.
I will. Come back and visit sometime. Come back and visit your old home.
Oh, I definitely will.
All right. Thanks, doctor. Have a good one. Mary, over to you.